Mesdames, Messieurs, ladies and gentlemen, what a great turnout. Somebody told me just a few seconds ago that, when Lawrence calls, people answer, and this is a testament to his leadership in the community. Alors, je vous remercie de votre présence ce matin. Fondé en 1953, l'Hôpital Montfort, par les filles de la sagesse, est aujourd'hui beaucoup plus qu'un hôpital communautaire servant la population francophone de Vanier. Let me share today my passion about the great work that we're doing today. You may not know, but Montfort of today is an acute care hospital with 289 beds, with a professional staff of 1,800, all compassionate and all committed to excellence and respect. We also have a good group of volunteers, and this being the Volunteer Week, I want to thank them for the great work that they're doing for our patient care at the hospital. Today we perform more than 10,000 surgeries and serve more than 50,000 patients in our emergency department each year. We have 128 beds in long-term care facility and 48 beds in our mental health program. We also have a bustling family birthing center, and more than 3,400 babies are born at the hospital each year. Today, Montfort is a francophone academic hospital that provides quality care for all we serve. We're actually very proud to provide care in both official languages 24 hours a day. I know that we have some of the best healthcare professionals in the country, more than 300 doctors, 464 nurses, as well as a myriad of technicians and other healthcare professionals. And if you haven't visited Montfort in the last few years, you probably don't know, half of our patients are Anglophone. So the perception that it's only for Francophone is not actually the populations that we're serving. En 2013, Montfort est devenu le premier hôpital francophone en Ontario à être désigné comme hôpital universitaire. Cela signifie que nous avons la responsabilité de former la prochaine génération de professionnels de la santé, la base en fait sur laquelle nous allons construire le système du futur. In 2013, Montfort became the first francophone hospital in Ontario to receive an academic hospital status. This means that we are all helping to train the next generation of doctors and healthcare professionals. In 2015, we created the Institut du Savoir Montfort, an institute dedicated to creating and transmitting knowledge to improve patient care, support the loved ones, and the health of Ontario communities. And last fall, our newly created research institute entered the prestigious list of Canada's top 40 research hospitals. Yes, Montfort is already part of the 40 research hospital in Canada. Considering that our research institute was only created 4 years ago, that's quite the accomplishment, and we're very proud of that achievement. But we never want to sacrifice the highest quality care because of our larger professional teaching and research mandate. For the past few years, we have been focusing on delivering care of the highest quality so that we can respond to and even exceed patients' expectations. L'Association des infirmières et infirmiers de l'Ontario a accordé à Montfort la désignation d'organisme vedette en pratique exemplaire, démontrant que Montfort met en place des pratiques qui ont un impact positif sur les soins des patients. And in 2014, we received an accreditation with honorary standing. This is the highest level of accreditation in Canada and a true badge of honor granted by our peers. An accreditation with exemplary standing demonstrates that we provide the highest level of care and safety to our patients. Month after month, for the past year, new mothers giving birth to Montfort has given us a perfect note. But don't worry, there is always room for improvement, and we will keep striving to ensure that every patient has the best care and positive experience. Another key aspect of the massive transformation at Montfort has been our involvement in regional healthcare planning. That means that all hospitals of our region work together to provide the best care and improve access to care. A regional approach to emergencies saves lives. That means if you have chest pain in your office downtown, you may be brought to Montfort no matter where you live. Every 7 minutes, someone in our region has a heart attack. We never know whose life will be in our hands. Chaque jour, j'ai devant moi la preuve que nous disposons du meilleur personnel et d'installations exceptionnelles. Nos équipes sont extrêmement bien formées et elles sont toujours prêtes à l'action. Toutefois, à mesure que les technologies s'améliorent, nos diagnostics peuvent devenir plus précis. Une technologie à la fine pointe nous permettrait de sauver davantage de vies. Et voilà pourquoi nous savons qu'un nouveau tomodensitomètre avec module cardiaque spécialisé est si nécessaire pour nous permettre d'offrir les meilleurs soins possibles pour ceux dont la vie est menacée par une crise cardiaque. Lorsqu'il s'agit de sauver un être cher, on insiste sur les meilleurs soins et le diagnostic le plus précis. Lorsqu'il s'agit de sauver un être cher, on n'hésite pas de faire tout notre possible pour fournir l'aide nécessaire à leur survie. Avec un nouveau tomodensitomètre, nous aurons un outil puissant à notre disposition afin de mettre toutes les chances possibles de leur côté pour vous, pour vos êtres chers et pour les milliers de patients qui, chaque année, comptent sur l'Hôpital Montfort pour les remettre sur la voie de la santé. Sans doute que mes collègues vont être capables et mieux positionnés pour vous expliquer l'impact de cette nouvelle technologie sur les patients qu'on sert. I am convinced that we have the best staff, top-notch facilities, and that our people are trained and ready. However, as technology improves, diagnosis can also improve. With the most updated technology, we can save more lives. And that's why we know that a new CT scanner with a specialized cardiac module is urgently required so that we can provide the best care for people at Montfort who experience a life-threatening heart attack every year. If it's someone you love, you want the best care and the most accurate diagnosis. If it's someone you love, you wouldn't hesitate to do everything you could to improve whatever they need. With a new CT scanner, we will have an even greater opportunity to provide the best for you, your loved ones, and thousands of others who come to us every year. My colleagues at Montfort will and can explain far better than I what the true impact of this new technology. I can merely suggest to you that your generosity can and will make the best care possible available for every person who needs our help. Every day, in French or English, no matter what the reason. We will be there for them when they need us most. We will be there for you when you need us most. With your support, we will keep striving to provide the best care for all we serve. I became a physician inspired by the story of my father, who actually had dialysis when he was 46. He actually received a kidney transplant the night before my interview at the Faculty of Medicine. And after that, even if his graft was successful, he lived for 16 years, he had multiple different medical conditions that required easy access, precise diagnosis, and I could appreciate how important that was. And we want to provide the same level of care and the availability of the finest technology to all of our patients that we are serving at Montfort. So thank you very much, and thanks for being here today.